Hey, Dennis, songa
Yeah,
kwa
yo.
light. Songa kwa light, you're dark. Songa kwa light.
Oh, I need more light.
Jennifer, it says you're live. Jennifer, it says we are live. Shall we begin?
Hi, everyone. Thank you for joining us for this conversation that is very, very unique to us, especially from developing countries. We are joined by a number of experts on this, who I'm going to introduce shortly as I hand over this conversation to Samuel. So we have, I will start from Martin. Please switch on your video. I will start with Al Kags. Al, please introduce yourself.
Hi, my name is Al Kags. I work at the Open Institute. I am very passionate about issues of data and trying to figure out how we can bring citizens closer to government, and that is the nature of our work. And I'm excited to be here.
Okay, Mercy.
Hi everyone, my name is Mercy Tege. I'm the Director of Programs at Plan International, Kenya office, and I'm really glad to be here.
Fatma? Oh, you're muted, Fatma. Unmute yourself.
I'd forgotten about that. Hi everyone, my name is Fatuma Ibrahim. I'm working for the Child Protection Area of Responsibility, which is based in Geneva under UNICEF. The Child Protection Area of Responsibility is responsible for supporting the coordination of child protection in emergencies. I work as the focal point for the localization efforts for the child protection in emergencies. Basically, my role is to support coordination groups to increase participation and the capacity of local and national actors to respond to humanitarian emergencies. Thank you.
Dennis? Dennis, unmute yourself.
Yes, hi everyone. My name is Dennis Mogi. I'm the founder of CRESNET. CRESNET is a child-focused organization working on child rights advocacy and also special needs education. But I'm also the chairperson of Action for Children with Disabilities Network, which is a network organization for disability sector organization working on children issues. I'm happy to be in this platform and looking forward to fruitful discussion.
And lastly, Samuel, as he takes over.
Well, thanks so much, Jennifer, for hosting us as Mtoto News. I think you actually need to introduce yourself also when I finish mine. So I'm Samuel Munyowing. I work with African Institute for Children's Studies, but I'm here with two other hats. One as a convener for a CSO network, the Children Agenda Forum. This has been existent since 2015, trying to improve communication and our advocacy around the SDG and children. I'm also co-chairing with Dennis the CSO response to COVID, which is through a national convening done by Kelin, looking at a rights-based approach to COVID response. Your turn, Jennifer.
Okay, my name is Jennifer. I hope you guys are not tired of seeing my face. I'm founder of Mtoto News. We make children visible and ensure that children issues are not left behind. I sit in the National Child Protection Response, COVID Response Task Force. Yeah, and we are here to discuss on how we can ensure that community responds to matters COVID-19.
Thank you, Jennifer. Once again, thanks to all the panelists and to the audience out there. There's a YouTube channel that you can follow us, and also through the chat, ask questions. and we will try and respond where we can. I think we all know this is quite a new thing. And in Kenya, we a little over 30 days. And definitely this has moved from being a problem or a virus associated with people who travel and people from China. It's now in the community. I think from the Ministry of Health, we are all aware now that we are having a community phase of where the people are getting new infections. And in my opinion, and I believe these panelists agree, that that requires or demands a community intervention, therefore. It's got to be community driven. And also that it's not just about a health emergency, it's also a social and economic emergency. So we believe that as civil society organizations, I want to think there should be a role for them, and that is what we want to try and define here, to give some checklist or templates that our fellow colleagues in civil society, community-based organizations can then pick from and be able to contribute to this response in an effective manner. So I'm really grateful that we have these panelists, and especially for Fatuma. Fatuma, I know you've had quite an experience, and even with your role as localization. If you allow, I want to begin with you. We all aware that while there've been emergencies, and yes, we can pick somewhere manuals that say what do you do in terms of emergency preparedness and response. But COVID is unlike that. Many of us were supposed to go to the community. We are being told stay at home so that I'm not at risk and I'm not risking the lives of those I'm trying to support. So my question to you will be, is there space for community-driven response? And what will be the role of civil society organizations in such a response? Your mic.
Thank you very much, Samuel. Your brief introduction has actually already put on the plate the role of civil society organizations. More than ever before, this is a local response because of the same reasons that you have mentioned. Travel restrictions, you don't have a lot of international surge capacity on ground. Restrictions of movement within the country also has made it difficult even for national organizations to be able to go to the field. So what do we have? We have the community. So we need to look at the local actors at the community level and to see what it is they can do. And there's a lot that they can do. One is community engagement. Local actors will understand the modalities and ways of engaging with the different parts of the community. If you look, for instance, at informal settlements, they have better knowledge of how or where they can work and who they need to contact when there's an issue. And around this community engagement is the big factor of risk communication. We know that a lot of miscommunication, misinformation, disinformation has happened, and who better than communities, community leaders or people that communities trust to now give them the information about preventing COVID, or even how COVID is transmitted. All that can only be best done by the people there. They can also contribute to prevention. First of all, they'll use the local language, which some of us may, even if you are Kenyan, there are some parts of Kenya where people don't speak Kiswahili. So who better than the local people to be able to do that? They can also participate in data collection, assessment. Remember, many schools, or really nearly all schools, are closed. So we have all these teachers who can actually be used or worked or supported to help to collect data. Also local actors, and here, but when I talk about local actors, I'm actually looking at community-based organizations. I'm looking at women groups. I'm looking at youth groups. I'm looking at some level of local authority. I'm also looking at faith-based networks because they are there, they are everywhere. And they are effective when they communicate with the people, because people really trust them. They can also be involved in providing the response services, what is required. Yes, this is essentially a health emergency, but we also know it has a lot of social impact. What about the caseworkers, the social workers in the community? Those people can help in terms of supporting. One of the things that is coming out very clearly is the level of stress and anxiety that COVID-19 has caused. They can talk with community members, provide support, and especially now that this has reached community level transmission, there's so much more that can be done. Social workers or all these other groups can work with the community health workers and actually provide the services. What needs to be done is to make sure that they have the protective equipment, they have what it takes to support them to move within the communities to be able to report. Because if we do not protect them, then they will not be able to do the work. In fact, they'll be at risk, they themselves, and also putting their families at risk. They can also support in the monitoring and reporting on issues that the government needs to know. And in fact, we should remember that in some cases, although the government is leading the response, there are times when people have not trusted the government. They would rather trust the people within them. That's why we really need to make sure that we support local communities to be able to be at the center of this response. Over.
Well, thank you. Thank you. From what you're seeing globally, and again, going back to a classical understanding of what is required for preparedness, response during the emergency, and also post-emergency, what will you propose or sort of, advise civil society organizations and community-based groups to have in their planning as they're planning to respond?
Thank you very much. Thank you, Samuel. I think the key thing that we have to address ourselves to at this point is to appreciate that where government is focused right now is on dealing with the crisis. So I think my remit here is to try and figure out what data is government focused on and what are the gaps that currently exist. Now, because of the fact that government is smack on dealing with the crisis, what they are really focused on is, number one, finding, identifying, and dealing with the COVID cases themselves, making sure that the people who are positive are tested on time, that people who are suspected are tested on time, and the ones that are positive, that the government is able to track and look for the contacts that they have. So in as far as data is concerned, and in that context, what government is doing is that they're using things like mobile phone information and sort of numbers, locations, that sort of thing, that sort of data to try and find the people who are contacts of this thing. The other thing that government is tracking in terms of data on a day-to-day basis that is within the medical field. We're talking about what facilities are currently able to host or able to house people in quarantine, people who are positive, the number of ICU beds, the number of hospital beds that are available, the number of medical doctors, nurses, and other staff that are available, and also the equipment that is necessary. We need a lot of ventilators. We need PPE equipment for these guys who are found to be positive, and also we need drugs to manage the symptoms. Because right now the situation with COVID is that while there is no cure specifically for COVID, when a person turns positive, what is generally treated is the symptoms that they're having. So there's medication for fever, there's antibiotics if it has gone to the lungs, there's pain medication, there's all those medications that currently are available. So these are the things that government is tracking at a #1 level. The other thing they're tracking is, of course, security. The security forces that are available, the equipment, the protective equipment that the security forces have, so that they sort of make sure that people can be managed. Now, even as that is going on, COVID has caused government to lock down the country, to take very radical measures that allow us to sort of stay home, social distance, so that it enables for the disease not to spread as quickly as it currently is. Now, in as much as that is what is happening, of course, we realize that as those measures have been, those very necessary measures have been taken, there is, I want to say, an impact, a social economic impact on people that is not necessarily being very well tracked. And I think this is where civil society organizations and citizens come in with an opportunity to be able to help sort of track that data and help the government also to find ways to respond to these things. The sort of information that I'm talking about here is #1, I think most urgently is availability of food and water within communities, and also the cost. There are many instances where a lot of people are going to starve because of the fact that they sort of eat on a day-to-day basis. They eat when they get money for today. So they will go, they work, they get money for today, they eat today. Then tomorrow takes care of itself, so to speak. Now, if they're not able to go to work under circumstances of lockdown, then of course, then they're in difficulty. But in addition to the situation then is that the places that provide these towns with food are also restricted in terms of how they can bring food and so on. Yes, food is still coming into Nairobi. Yes, food is still going into Mombasa, but there's a significant restriction, and that restriction then causes shortages in different communities, especially within lower income neighborhoods. Yeah.
Oh, very, very good points. And one of the things I mentioned when we began preparing for this was, I'm sure as a community member, there's data that keeps coming, and honestly, it just creates panic rather than really give me an indication that we are in control somehow, or that we are tracking what is most important for me as a community member. When the Cabinet Secretary for Health gives us that now we are at 225 out of 9,000 tested, how important is that data for us as a community member? And is there a space where we can find the other data that really are equally essential for us? Just exactly what you're saying. Where do I find the data on how many people are hungry in my neighborhood? What do we do about that?
So the current situation is that it is not very possible for even civil society organizations and citizen groups to collect quantitative data because of the lockdown restrictions that currently exist. This is just fact. When people, even if you decided to, for example, use the Nyumba Kumi system, and people have to go out to try and get quantitative data, then they're putting themselves at risk. And a lot of them are within the category that is what you call higher risk. They are already in a higher risk group. But what we have done at the Open Institute is that we've been working together with a number of civil society organizations, and what we've been trying to do is to figure out, are there ways in which we can track observances or observations from citizens who then post on an app the information that is currently sort of needed. For example, is there a way that we can get a citizen group in Nakuru to begin to post? If you go to the app, it's nuru.life, it's called Nuru. And if you go to online, you'll find it on nuru.life. And when you go there, one of the things that you'll be able, and you download the app, you'll be able to update for yourself what is happening within your community. You'll be able to say things like, people are fighting over food today. We have not had water since last week. Now, if you have within one community a number of people complaining about the availability of water, then you are able to begin to see that within Nairobi, within say Westlands, there's an issue with food, and therefore people then start. We can then figure out ways of responding to those particular places. That's the general idea, and I think that's how, as civil society organizations and as citizens, we can possibly help us to improve. A lot of civil society organizations have...
On that, Al, it is expected that healthcare workers will be more the frontline teams, and there are existing structures that have been used in this country and most developing countries, especially community healthcare workers. Some of these fellows have equally, in fact, a list of households that they are responsible for. A number of households, especially in countries like Kenya, do have access to phones, even if they're not smartphones. Is this being explored anywhere? And perhaps a bigger question is, where will such data go to, and how does it find its way to the national response team?
So I think that I think that's actually the point I was going to go to say that as civil society organizations, there are many organizations that already have access to these community healthcare workers and even community leaders. What the opportunity is, first, the information has not been tracked. So secondly, the opportunity here is for civil society organizations to mobilize the community leaders, whether they be community health workers, but even others, to use their phones, to use their networks within the communities to track what is needed, what information is. For example, easily track with the family mostly in need of food, what shortages currently exist with regard to water, what shortages exist with regard to healthcare, and I'm talking about healthcare being non-COVID related healthcare, because maternal health is an issue, children health is an issue. These are all issues that community health workers can be able to track. And what we're offering Nuru for is for them to perhaps use that, so that that data then is available to not only the government, but to also other stakeholders to sort of begin to provide support to those people.
Let me request Mercy to come in. I know you've had the Vurugu Mapper that has been used, for a while now in the coast region especially. Is there an opportunity for that? And how can it go beyond where your project areas are?
Yeah, thanks, Sam. And yes, we have extensively used Vurugu Mapper in Kwale and in Kilifi. And just before we came to lockdown, we had the last testing before Vurugu Mapper is actually integrated into CPIMS. So unfortunately, by the time we went to lockdown, this had not been finalized. And although the app now has been transferred to the server at eHealth hosting for the Department of Children's Services, it cannot be used beyond Kwale and Kilifi. I checked about yesterday or the day before yesterday, and yes, the community health workers and the community volunteers who have access to the app are still using it. And we can see a lot of communication going on, and also now being manually put in CPIMS. But I think that is something that I would really commend the Department of Children's Services for, the fact that they finally agreed to adopt the app and integrate it to CPIMS. Now the rollout is what would really have supported us in this crisis, but unfortunately we have not been able to roll it out in the 47 counties. So I think it's a lesson that and a missed opportunity that probably we need to think about very seriously as a children's sector immediately after we are back to normal.
Mercy, I'm tempted to say, I mean, we need this Vurugumapa now, but you're telling us to wait until we come back to normal. What do we do?
Yeah, I know, Sam, and it is very unfortunate because the integration to CPMS had not happened, and it takes a bit of initial investment because you need just an ordinary phone, not a smartphone, but you need a phone, and you need people to be trained on that. So now the opportunity for
Mercy, are we able to collect our own CSO data? I know there's a process of government checking to validate and all that.
Mm-hmm.
But where you have nothing, I would rather have data with some percentage of error than completely nothing, so that we have what you have, we have the Nuru Live, and we begin seeing whether there's a trend. Can civil society get access to such? I know you can't make this decision fully on this call, but is that something can be considered? Okay.
Yes, sure.
Maybe, Jennifer, it would be a good time for you to also tell us, from a National Child Protection COVID Response Task Force, is there anything cooking to enable us to synchronize data and to allow citizen-driven data to complement and fill in the gaps from the government system?
Thank you, Sam. I know currently the Department of Children's Services and partners, they have been meeting for the last several weeks. Actually, we had a meeting today morning, and the mapping has started. The CS has started mapping different intervention by different communities, starting from the community level all the way to the national level, on who is doing what in terms of child protection. And this is specifically for child protection, not everything, like mapping out cases of child protection concerns, and also who is doing what. And from the report that was shared in the morning, there's good progress people are doing, and also people are doing amazing work. I belong to the End Child Marriage network, and that's a concern. Last week we had a meeting and there were no cases. This week we had a meeting and the cases had spiked. Places that we thought would not have child marriage cases have spiked. So it is a matter of how can we start reporting? And I know at the End Child Marriage network, we report every week how many cases have we reported per county, and who are you working with to be able to reduce those cases. So yeah, at the national level, I know DCS is working extra hard. They're having meetings every day to ensure that there are interventions, but also as CSOs at community level, at national level, I know there's work going on.
Good point. And maybe just my own thoughts that civil society need to begin at the community level again on this, because if we are engaging with the county level COVID response teams, perhaps it's much easier to be taken seriously, for lack of better word, which is something I want to throw back to Al.
Okay, Sam, let me add there. So for example, in the End Child Marriage network, one of the things that we are using is community champions. Like I know Plan, Mercy can attest, is part of the network, and one of the things that we are using to get the data is community champions who are reporting to us and telling us these children are being abused. There's FGM going on. A child has been married there and there. So these community champions, and those are individuals. They don't even belong to an NGO or something. Those are like human rights defenders, HRDs who are all over. They're the ones who are reporting to us and telling us, guys, do something about this. And so because it's happening, and because we don't have community structure, those ones are the ones we are using, like the ones that belong to Child Fund, the ones who belong to Plan, the ones who belong to AMREF are the ones who are reporting about these cases.
So Al, you know, this is the time you want to maximize on any resource. You don't want people to put effort where it doesn't count.
Yes.
Will our voices be heard, given your experience at the national level? Will our data get any ability to influence some policy decisions?
I think that it will, and I think that at least in our experience, government is also very open in terms of engaging with anyone who is trying to help in any way. I think one of the big things that they are doing is that they are, of course, quite overwhelmed with a lot of the needs, because of the fact that we do have a shortage of medical equipment. We do have a shortage of PPEs. They're getting better, but information, structuring information, especially for the security and for the humanitarian response, guys, is significant. If, with your permission, Sam, I just want to show you what citizens are currently doing on Nuru.live. If you're able to see the screen right now, this is actually information that is coming, that there's a column here called user feedback. And what you can see is information that people are uploading from their spaces, wherever it is that they are. They're talking about issues of the price of masks has incredibly been hiked. Organizations in Kapsabet are giving information. We've got information about youth being sensitized. So what community leaders are doing and the way that they're using the Nuru app is by simply uploading whatever it is that they feel is important for the world to know. Now, as you begin to see that on the left side, you begin to see that there's issues of discrimination that are beginning to arise, especially from a human rights standpoint. You will find that a lot of the human rights violations that will happen during a situation of scarcity like this one will arise from citizens themselves, not even from government, where people begin to discriminate each other. There will be issues of restriction of movement, there's issues of shortages of masks and so on. So what I am essentially advocating for, or what we are essentially advocating for, is for civil society organizations to bring as many of their people as possible to begin to share information that then begins to, when you have enough information coming from different sources, then it all begins to coalesce itself in one place. And then it is possible for someone who is interested on issues of children to come and filter that information and collect that information, analyze it and provide it to the relevant agencies of government, so that then there's action taken. I think the best way for CSOs to relate to government right now is to collect, analyze, and then synthesize the recommendations to government, and you'll find that those are able to be worked on. This is a time where everybody comes together and supports each other.
Thank you, thank you. Dennis, I don't know whether you have any experience, and especially looking at your constituency of children with disability. Is there data? Are you finding an opportunity to go into the community to do work?
Thank you for, yes. I think the issue of children with disabilities for a long time has been, and data has been a big issue, simply because there has not been a lot of effort done and measures put in place to ensure that we have accurate data on the so-called vulnerable populations of persons that we have, including children with disabilities. But what we are seeing is that children with disabilities or persons with disabilities are no exception to being affected by the COVID situation. So that in itself, it's a wake-up call to all of us that are working in the sector, that yes, there is an opportunity for us even to go now further and collect data, so that we are able to provide evidence that yes, this is something that is heavily affecting persons with disabilities, children with disabilities for that matter. I know there are some initiatives from organizations that are working with children with disabilities in terms of monitoring and following up on their beneficiaries. But we would like to see such kind of initiative, because for proper planning and interventions to be put in place, we need a national kind of data, as opposed to where we have segments of data, pieces of data littered all over. So
Dennis, so in your neighborhood, for example, or in your project area of operation, will you say that the current response as is planned, and I hope Jennifer or Fatima could get ready to also tell us what should be in the minimum package of response to COVID at community level. But for you, Dennis, what will you say is missing out in the current response, especially at community level and looking at special populations like the one you mentioned?
Yes, I think one of the things that I've clearly mentioned is that issues of persons with disabilities are not very visible in the current response. And that leaves the population to be much more vulnerable, double or triple the way they are at the moment. When you look at examples of, take simple examples of children who have several conditions, like those that are suffering from epilepsy, those that have Down syndrome, those that are having autism. These are children who are on frequent medication. And when we get reports that the essential drugs for these children or for these people are not available, then it raises a big concern on the access to the right of health for this population of people. Even the communications that are being done in the community or from the national level themselves, what we are saying is that they are not accessible to communities or categories of persons like the deaf, who cannot really interact so much with a lot of print material which are available. Those that have intellectual disabilities, of course, they have low abilities to read written materials. So what we are seeing that there are huge gaps, that the information itself is not accessible to them. So a number cannot relate to understand what is happening around them. And this is perhaps why we are seeing some spike of cases, violence on persons with disabilities. We have some cases reported across the country where a person with hearing impairment was actually brutalized during the curfew period. Another one who had some other challenges was also brutalized and succumbed to death. And this is because even the general public has not been made aware to understand how do they support persons with disabilities during this time.
Maybe a quick one on that, Dennis. And my organization as African Institute, we are working with a few other organizations, like Camellia organization who have mental health clinics, with Open Society and others. But what I'm missing here is our current frontline workers who are healthcare workers, and are you finding them sensitive to these social dimensions of the response? Or I don't know if you have any experience, and I will also encourage Mercy to respond to that.
Maybe just to respond to that, I can say, being sensitive is one thing, but also having the knowledge and skill to address or to deal with the challenge is also something worth to consider. Yes, it might be sensitive, but where that person lacks the accurate knowledge or the skills to address that kind of scenario, it's already a bottleneck in itself. Take an example, the health workers. How many are able to communicate in sign language, for example? Very few have got such kind of training in sign language. And look at police officers, for example. How many are able to understand that persons with autism react in different ways? Where there is noise, they become very hyperactive. Those that have intellectual disabilities,
yes,
they are used to some kind of order. So when that order is distorted, it confuses them. So when we have a curfew, what does it mean? You are likely to find a person with intellectual disability on the street, not knowing what is happening, and is likely to be
yes. Very important, Dennis. And two things I want you to kindly remind us to put in our take-home messages, or what people can do as implement. One, I think there is need for a very long-term advocacy around making our health systems, especially health delivery centers, sensitive to persons with disability. We've spent quite some money to make youth-friendly centers, even for HIV, but I don't remember we passed training persons, rather healthcare workers, to be sensitive. I have a case that happened in one of the health centers in Kajiado, because I do a lot of my work there. And a couple, you know, walked in, both the husband and the wife are not able to speak. And the nurses were heard saying, so who is going to attend to those ones? They can't even speak. And I was imagining, what will it take to make sure every health center in this country has someone who just does translation? That's the only job they do. And they can be called, even if it means requesting someone with such a disability to book an appointment, and then the person to do translation will be made available. I think that is not too much asking for it. But also, as when we get to the point where we need to sort of remind our audience of what can they do, I'll want to request you to, again, tell us from your expertise, what will you recommend for community-based organizations, for neighborhoods to think about to support persons with disability in this response? Mercy, any thoughts on this?
Yeah, thank you, Sam. And you raise actually a very critical point that there are times when we are sensitive towards everybody else, but not people who have certain disabilities. And yeah, when we think about persons with disability, we think about people on wheelchair. But yeah, autism, like Dennis says, is really a unique disability where the reaction might even seem violent and might be misinterpreted, and you find those people being harassed in their communities, and especially by the law enforcement, because nobody understands what they are going through. But yeah, I think I have a very good experience in one of the informal settlements where we are responding, and that is in Kibera. And when we distributed the hand washing stations, there's one particular girl who came and said, out of all these hand washing stations, there's none of them that is friendly for the people who come in wheelchairs. She just put it as plainly as that. And that actually got us thinking about where to position the hand washing station. So the community health workers might not know exactly what to do. And because fortunately, the largest population is those who can be able to move themselves around, we tend to forget. But I'm thinking about what you've said about the health centers. The health facilities actually being able to have someone to interpret. How about that being incorporated in the training of the community health workers and even the medical staff? So that you don't need anyone to interpret, you have the basic sign language that you can be able to communicate with a patient or with a client who does not talk. I think that is a more long-term solution that would really work well for us. And in this case, maybe one point of advocacy really is to make sure, like we are talking about children in the children's sector, we are not hearing much about them, and we are all up in arms and we want them heard. I think we need to shout as much for people with disabilities and very specific interventions for them. Because right now, they may not be able to go to work. Parents with children with disability have it even more difficult because with the lockdown, they might be facing some other social issues that we are not even aware of. So I think it is very important that at this time, the government is hard to be talking about persons with disability, and their plight also included in the national response plan, because I think that right now that is not there. So I think it is very important that we come out and talk about it, people like Dennis and other organizations, and even for us who have occasional interaction with people with disability, I think that's a voice that has been left out and that needs to be heard.
Thank you, thank you. And allow me to mention, I know some organizations, including ourselves, are already developing videos that can be added to the Ministry of Health portal for the continuous medical education. So maybe what we will require is to know, I don't have that information, but if anyone has, who is a focal point person, so that as the health workers remain the front line, then they are sensitized on how to address child protection. For example, the mandatory reporting of any existing ongoing child abuse case. How is that happening? Are they equipped? Do they know which number needs to be called? But also importantly, that we need to see the county coordinators for children, the volunteer children officers, engaging with the county response teams for COVID, so that it's not largely a health-driven or a medics-driven response, but then they become sensitive. Fatma, I want to request you to kindly take us back to what will be in a minimum package for responding to this kind of an emergency? If a CBO today says, oh, I listened to this webinar and I think I want to do something in my community, what should be in their checklist of planning?
I think, first of all, before you even get there, we would need to identify or support, like when I talk about we, I think I'm more likely talking about national NGOs, to identify the community-based organizations in the different areas, particularly priority areas. You need to see where is it that we need more support. So identify those community-based organizations and other networks, and also identify what capacities they have, so that the minimum package is actually linked to the kind of work they can do. I think one thing that, in fact, listening to the other panelists, that is coming out is the issue of information. How are these people getting information? And what kind of information are they getting? In what language are they getting that information? So you could have community-based organizations or networks working around the area of information, providing accurate information and actually linking with the health workers, because a lot of this information is still very much linked to health issues and the prevention. They could be able to do that. Then another thing that they could do quite easily is to identify the gaps in the services. In this location, we have not seen any increase in water provision or even hand washing basins. So we need to be able to reach now the local authority or whoever is responsible to provide that. One other thing that everybody is forgetting, because we are also hyped into responding to COVID, there are issues that are being forgotten completely. And this brings again the issue of linking with local authority and sometimes even with the police. Those people within these communities which are not easily reached may have needs to go to dispensaries or to hospitals. For instance, there have been reports of pregnant women who are heading to the clinic to give birth and then they are stopped. Now, who works on that? It just has to be the community members who can liaise with these people to ensure that other issues are not forgotten in the response to COVID. I think also finding out those parts of the communities that are not connected. They don't have access to cell phones. They don't have access to internet. So how are they going to be reached with the information? How are they going to know what services? And here it's not only the informal settlements in big cities or something like that. What about the rural areas? If you remember in Kenya here, when the lockdown or talking about lockdown started and people were told to stay home, a lot of people went to the rural homes. And maybe some of them were already positive, but they don't even know. And they take this burden to the rural villages. So how are those people receiving information? How will they know what is required? What services are there? Again, it's through linking with the local networks. But who is going to link the local networks? For me, it comes back to national organizations that already are working probably with some of these local networks so that they can now close that gap. And then based on the different contexts, you may have to come up with a checklist of what is actually required for that particular instance. Something else that has just come to my mind is also linking with the private sector. You have seen that in many ways, the private sector is coming in, especially to respond. But who is informing that process? It should be these people with the local knowledge of the area who should participate. So linking them to some of these, as you rightly say, to some of these task forces may be a good way of already creating a linkage between what is happening at a certain level and what is happening at the community level. But they do need support. They may need some orientation on what they should do, or even on how to advocate. We are asking people who have never been in this situation to advocate with a local authority. How are they going to do it? So it's really important that some kind of orientation, online support, peer-to-peer learning that should happen along with this minimum package. Thank you. Over.
Thank you, Fatuma. That reminds me, from Children Agenda Forum, the SDG advocacy group for children, we've been trying to map out who is working in which county, have a lead agency. And I think those kind of lead agency will be really appropriate to then identify the CBOs that they usually work with and share information, maybe have their own county level WhatsApp group and say, this is what I'm doing here. And if we have the tools like the one Al are providing of Vurugu Mappa and others, we could quickly get more data, or even just use a simple Google form that then, you know, when I enter data, I can see what the other person has already put in to get out of this call. Al, we had a conversation with you, and I was giving you an example of Kenya Association for Intellectually Handicapped, who we work with in a partnership. And they try to distribute food and other supplies to persons with mental disability in the slums in Nairobi. But now what they have gotten to understand is we are being told, please don't distribute things, take them to the county government or central place. And they are asking the question, how will we know that what we gave will get to the target group that we've always supported all these years?
I think by my understanding is that there's been some confusion when that announcement was made in the media, even amongst the administration officials. The good thing is that following a conversation with some CSOs, there was an intervention done by government. There was a set of guidelines released by government of how humanitarian initiatives should be done. And I think it's there's already a set of guidelines that we can follow, and I think for as long as CSOs are within the guidelines, and the gist of the guidelines is that you don't have to take it to the administration for them to do the work, is that you have to make sure that they are aware of it, because of the fact that they are able to help you to control the crowd. I think what government was responding to at that time was a number of humanitarian activities that were done by some private sector and CSOs, in which there was scuffles that ensued with people fighting over the thing, and social distancing then became a complete mess in those situations. As CSOs, we might not have the capacity to organize the community to social distance, to be orderly, and so on and so forth. But if you work together with the administration, then you will make sure that the things get to places. So I think the basic management with for CSOs is to make sure that we bring the administration with us as we go to do the humanitarian activities that we're going to do.
And if you don't mind, if you have links to those guidelines, sometimes not all of us have access, you can post them to the YouTube link so that anyone else can download them from wherever they are. Maybe before you leave, in terms of some to-do lists for CSOs that are listening, would I be right to say, one, there's space for CSO-generated data? Perhaps it will even make it much more acceptable if we engage the local authorities wherever we are working from in telling them this is the data I have, but also that civil society organizations need to strengthen their own existing networking platforms. That gives them an opportunity to speak loud and for their data to be counted, because you may have your own data. If every one of us walks to the national response team with their own data, it may not make much unless it is synthesized, it's analyzed, and we are all agreeing that there is some level of science acceptance in terms of the methodology and or whatever source we are having. Anything else you want to give us as a take home?
I think one of the things I wanted to speak to is especially for those organizations that are dealing with special interest groups, you know, the people who are dealing with people with disability, people who are dealing with children. I have seen some information around some organizations that are dealing with women and children in prisons. I think the one thing that is really important is to make sure that those voices are heard, but with facts. A lot of times we can say there are many people with disabilities who are disenfranchised or who are suffering and so on and so forth, but we do not have any information to back it up, any facts to back it up. And that usually makes it really difficult for not only government, but even other stakeholders to sort of come and be supportive, because of the fact that if I were to ask how many were, I want to provide masks to people with disabilities, I want to provide, you know, I want to make sure that I go to Mombasa and provide water to households that are people with disabilities, you find that that information isn't there. And we've been engaging even with organizations that have been dealing with people with disabilities, including the NCBWD, and that data does not exist. So it becomes very difficult. There's an opportunity right now for civil society organizations, especially those dealing with vulnerable groups, to work a little extra hard to make sure that there's data, there's organized data, and that they're working together. The other main challenge that we're having among CSOs is that there's a lot of silos. I'm one government official, for example, and I'm having to deal with 6 different networks that are coming to me to tell me of different things that they have. And at the same time, I'm dealing with a crisis. It's very difficult. So the one thing that as civil society organizations, we really must emphasize and try and do very strongly is to come together so that now, when we go to government, we go with one unified voice, we go with one unified set of data, we go with one set of recommendations. And what happens is that then it becomes a lot easier for government to not only work with us, but also to make sure that they're responding in the ways that they should. It is not in any of our interests for a government official to waste time meeting with different people, where he could meet with one person and then make sure that he goes out to do the right thing. So I think that is the main takeaway that I would have here for civil society organizations. We're in the testing phase for Nuru, and we're looking for as many partners as possible to help us to test this, to give it a lot of stress testing this week. By the end of the week, we hope that it will have gone live on Google Play, and then it will be fully available to everyone. The other thing that we're doing with Nuru is that we are translating it into Kiswahili right now and French, so that it can be used, because we have demands for it to be used in a few other countries in Africa. But what we are hoping is that we can be able to find partners who can help us to translate it into Kikuyu, Luo, Somali, and so on, so that it is even easier used in as many communities as possible. So if there are organizations that wish to participate in one way or another, please let them reach out to us. Thank you very much. I'm sorry.
Thanks, Carl. We have other platforms that we can engage in.
Thank you very much for having me.
Yes, thank you. So I know the SDG forum is one platform. You can be found, and many other groups, people who are here. Yeah. I think maybe for development partners, and one of the things that we keep missing is we don't strengthen these kind of networks and let them remain networks, because I know one of the challenges, every time you register them and they become organizations, and they lose the ability. And we needed them now. So I think we've got to, work on it, even as we try and make them to respond at this time. We'll keep definitely in touch with you, and perhaps if you have any contact that you'll allow our audience to follow you through, you can post it on the chat on the YouTube.
I'm very active on Twitter, Facebook, everywhere, and the name is simply Alkag. So feel free to reach.
10 minutes or 8 now. Jennifer, anything you're noticing, but also any pointers from a national point? What do you see as you wrap up almost? But begin with the questions.
So thank you, Sam. For me, what I'm seeing, I love the conversation that you're looking at community level, and as Mercy said, it's a shame that we had not strengthened our community systems before this. But now it is a chance to, to fast track this strengthening of the community systems, because we have very good documents. We have got documents like the National Psychosocial Support Guidelines that has multi-level kind of support. So for me, it's a matter of how can we start thinking fast to fast track some of these things. We don't have to wait until the pandemic is over for us to do something about it. For us, is how can we start working now, so that, because children, for me, I'm very passionate about children, and my inclination is to children. Children are being harmed every day. The judiciary was the first one to sound the alarm. Now even the CS Kagwe is sounding the alarm. If this thing is happening, why should we wait until we are back to quote unquote normal for us to do something? For us, instead, as CSOs, start thinking of innovative ways. Nuru is one of them. Vurugumapa, for me, it's challenging. Mercy, and how can we start rolling out? Can we come up with a simple, even if it's an USSD kind of a reporting format, that we can empower communities to be able to report at community level, so that the intervention starts now? We don't have to wait until the end. So we have a number of questions. Thank you guys who are watching. We really do appreciate. We have a number of questions. We have Naomi, and probably this question I'll pose it to Mercy, who is also in the National Response Committee for Child Protection. So the question is, any report about children in quarantine, are they receiving child-friendly services? And is the environment adapted to suit their needs and keeping them safe? Mercy, I know that question, I think we spoke about it during the last meeting. Probably you can talk more about that. Mercy, unmute yourself.
Yeah, thank you, Jennifer. And just to say that, yes, it is true, the children who are in quarantine are receiving the services that they need. It is not perfect situations, because I think every situation in this COVID response is not perfect. But I have seen the government and the institutions that are holding the children doing the best that they can to meet the specific needs of the children. And I've also seen some other NGOs coming out to meet the specific needs of the gender that is quarantined. So I haven't heard of any center that is holding children and you don't have pads and you don't have gloves, you don't have masks. So I think that is something that I would want to say that it is happening. The only thing that I would want to say is that that special care that is given to children and people who are specifically trained, I know our resources are quite stretched. But I think everyone is trying their best to make sure that if it is children, the services that they're being given are child focused. If it is the messages, I know we are struggling a little bit about the messaging for children, but I think it is everybody is now realizing this is a special group that we need to take care of. So I would say that, Naomi, yes, thank you for the concern. A lot is being done and a lot can still be done. I can tell you that the resources are very scarce, but everybody is doing their best about the children in quarantine. Over to you, Jennifer.
Okay, thank you, Sam. I think the next question from Leila is to you, because you're in the Special Task Force for Children in the justice system. Are there interventions? This question was in two folds. So children who are in institutions and children who are living with their mothers in institutions, are there interventions for these children, considering the government directive of decongesting prisons? But where are these children being taken care of?
Well, thanks. I think the children in institutional care or in child justice institutions there's a similar queue to try and make sure that they are not kept in the institution, decongest those institutions. Of course, there is all that process of being careful that even as you take them back to families or to alternative care arrangements, including other families, that will still be done. I want to say from the task force, I think effort is being made to ensure that due procedures are followed, that again, we don't have to wait for long periods for courts to approve some of these. So people are looking at using even online mechanisms to be able to get court approvals and give directions on where to give alternative care. So I will say there's good effort.
Yeah, Jennifer, and if I could just add something to what Sam has said, I also know that the institutions that are holding children in the juvenile justice system are really trying, including fundraising for themselves. Like we received a very specific request to supply pads to the institutions, which we have done now. To a few girls' homes and also to the remand home. So everybody is doing their best to make sure that what the government is inadequately supplying because of the resources that they have is actually being complemented by the partners that the various government departments have had. So everybody is trying to fundraise for children, and especially those in the justice system, to remain comfortable.
So Mercy and probably Josephine and Dennis, there's a suggestion here, and probably something for us to discuss about how can we make communities like, this is from Dr. Njoka. Let me just read it as it is. He's suggesting about how to be innovative in data collection. He's saying, just give me a second for this thing to load. Because we are talking about mapping, where is it? Has it disappeared? Okay, so he's saying, since this is on mapping, can the organizer pick up a leader in each region, about 10 of them, and mobilize CSOs to gather data? Then it is compiled and a national CSO report is produced. So this is a suggestion from Dr. Njoka, and also I think he's made a number of suggestions on how we can be able to ensure that we have like data that it's more proactive than just waiting for government to give us numbers, but also data that is, as I was talking about before, about that is going to talk not only to health and economy, but also to the social aspect of COVID-19. So he's suggesting that, and he's asking, are we able as CSOs to be able to do that? So he had also suggested something else. Like using community development approaches of using of mobilizing communities to be able to be proactive and to be able to deal with these issues. I don't know, probably Josephine and Mercy and Dennis, we can be able to talk about this a little bit.
Yes, Jennifer, I think the greatest need right now is for people to actually share the data. I can assure you, like, just take an area like Kibera, where we are heavily investing as Plan International. You realize that we have our volunteers, we have the community health workers, and also our girl advocates and our youth champions, and they are collecting data for us. So I think that's a very good question from Dr. Njoka. So how do I then make sure that this data that I'm going to collect, and I collect at the end of every week, actually gets to a national database to see who was served with what by who, and exactly what needs we are dealing with. So I think there's a very pertinent question there, that people may have a lot of data that they will not share. So where is the platform? And I think this is for all of us. Where is the platform where later on, or even on a monthly basis, we can actually share this data to show what was happening and the actual needs that were being met? And even as we continue with the response and think about the recovery, what other needs other people can come in and share? The data may be there, but how to share so that somebody like Dr. Njoka can know what Plan International, what Save the Children, what World Vision, what Childline Kenya is doing is what is now the real issue here. Again, going to Martin's sentiment, where is the coordination? I think that is what we need to really think about.
Okay, Dennis, you can go also as we give our sort of parting shots as we go around. Go ahead, Dennis.
Yeah, the way Mercy has put it is exactly what was in my mind, that we have lots of data around us, but then we need that central point where all of us that can feed that data into. Because I chair a network of organizations working in the disability sector with a focus on children. And we have data on children with disabilities of all aspects. But for us to use that data to influence national policy, it means it must be coordinated somewhere where it is analyzed and then presented in a very coordinated way. Maybe as part of my closing remark, what is coming out clear in this webinar is that, one, on matters data, then we realize that there can be different loads of data that can be collected on whatever one wants to focus on. But I think also we need to be very much purposive in terms of what data are we going for? What constituency are we speaking for? This meeting is coordinated under the umbrella of Children Agenda Forum. So I would say that our underlying data that we should be looking for is data on children. Children in quarantine, children who have been abused, children who are in situations that their rights have been being violated during this time. Because there is a tendency of providing, just general data, which is not disaggregated. Number two, I get that, again, we are working in a humanitarian kind of situation where things are, very much regulated, controlled by the government guidelines and so many other things. But I think it is coming out very clear that CSOs should be regarded as one of those frontline worker or entities. And that means then that any guidelines on maybe social distancing and the quarantines and the curfews should not hinder delivery of services to the affected communities by CBOs. And I think this is something, an advocacy item that we need to carry, all of us outside there, so that as we are engaging, we should be flagging it out and say that we need to continue working, reach out to the most vulnerable in the community. Coordination is very key, and I will be looking forward to platforms like Children Agenda Forum, Action for Children with Disabilities that we coordinate, to provide that coordination role, so that at least we can coalesce at one point, maybe at the national level, where we are represented by Jennifer, to channel this information and data that we are having. Then maybe of importance to think about, within the community, you realize that there are different entities that are coming up in the communities that are critical entities to be engaged. For example, for a long time we talk about women groups, youth groups, and so many other groups. But of essence nowadays, you find that there are residents associations. There are these border groups. And in most discussions, especially around this time, you hear even the minister making reference to them. So as a community response approach that we want to mount, let us remember to map out who are these new emerging structures within the communities that are critical for us to engage with. The border associations are very critical. When you talk of, when you think of even things, supporting things like food deliveries to affected families or communities, they can play in a hand. I note also that there is that apathy to have the right information at hand, either with the general population or even the organization that a number of guidelines are out there from the government, from the Ministry of Health, but the trickle effect down to the lowest communities, down to the entities, is something that we need to look at. Those of us that have access to these guidelines, share them widely with the other entities that are working with us. Thank you.
Thank you. Is Mercy still there? Any parting shot?
Yes, Sam, I'm here. I almost dropped off, but thank you so much. I think for me, what I would say is that there's a question that was posed about how do we enter into a community? And I can tell you that the communities are so willing to work with anyone who comes with the structured way of helping. We went asking who is going to man our hand washing stations. We don't even have enough hand washing stations to be manned, because people are like, we need to end this crisis and we are in this, please involve us. There are places where CSOs who are working at the national level and even some at the community level cannot access. But we have community members who are there who are willing to work with us. So let us talk to them. Let's work through the local structures. Let us work through the local government. And I can tell you, to end this crisis, we have a lot of goodwill from everyone in the community. And I think everybody is doing their best for us to go back to a better place than where we have come from. So thank you all so much. I'm happy to be part of this discussion.
Thank you, and we hope we can know how to explode Vurugu Mapa, make it available to many more soon.
Yes, a challenge well taken. I'll take that forward.
Thank you very much.
All right, okay, all right.
Sorry, Jennifer, I hijacked you. Do you want to give any order? Any other person to give their final comments?
No, it's okay. It's okay. So
Fatma?
the other one is guidelines. We have a lot of people asking for the guidelines. I'll take it upon myself. I'll look for the guidelines. I'll post them on Twitter and on Facebook and on the comment section of the YouTube, so that you can have them. I've asked CAGs to send some of the guidelines, but I'll also look for the guidelines. There are some that was just sent by the AU and UNICEF. I'll try to post the links on all the platforms in the next 2 hours or so. So yeah, thank you so much.
Hey, Fatma.
Fatma, I can see Fatma. I think Fatma can respond that question on communities.
Jennifer, what is the question on communities, please?
Okay, it's here. Wait just a second. So, where is that? The gun for children. So, like, how can, like, it's basically a response to for children at the community, and that what Dr. Joka was talking about mobilizing communities to be able to develop community-generated data instead of us being more proactive as CSOs than waiting for government to give us numbers at the end of the day, of every day. Like, how just get into that discussion of how can CSOs work together to generate data, and that's what, like, I was challenging Mercy and CAGs earlier on how can we harness all that to be able to generate our own data.
Okay, thank you very much. I think on the question of data, that has been discussed quite a lot. I just want to add 2 points to that. One is that the older children should be involved in this process. I think one thing I'm noticing with much of the work that is going on, that there isn't enough child participation in all these processes. We need to bring, especially the older children, into some of these discussions, the planning, and even the response. Second thing about the data is, when we talk about data, we are always talking about collecting, bringing, and then developing, but you hardly ever hear about that data going back to the people who collected it in the first place so that they can also use it. We need to make sure that that happens and find ways, because otherwise they feel that it's going, it's never coming back to them. So I think that's an important point. Once those people, the entry points are identified, who bring the data to wherever it should be, whatever the analysis, the decisions, what is going to be used for that data should be communicated back to the community. In terms of my concluding remarks, I would like to say that this was a great opportunity to be on this webinar, to hear what is going on with the other panelists, great ideas. So I just want to say that there is a very important role of especially local actors at the community level in the preparedness and response to COVID. However, we need to make sure that they are mobilized, and I don't think from what I'm hearing that we've really had a good process of mobilizing them. We have to agree in Kenya, we still have some level of movement. We can couple that with the online work that is happening. Mobilize these community actors, the community leaders, whoever, I think it was Dennis who talked about these emerging groups. How can we get all of them together and work with them? So mobilize, coordinate, but also have a mind shift, because the mind shift has to come from the national organizations. How can they work better with the local actors, but the confidence of the local actors to feel that, yes, they have something to offer, because usually they feel nobody really thinks about them. They are very timid, not confident. We really need to help them to be able to do that. Thank you very much.
Thank you.
for me, this conversation is very, very important. And as we move, I was telling some people that nowadays we are living the biblical times of give us today our daily bread, because tomorrow things will change. And things have, since the last 4 weeks, things have evolved so fast that you don't know even how to plan for tomorrow. And it's for me, this conversation, it's sometimes you feel as CSO is as if you're doing catch up with government. Instead of us being partners, we are doing catch up and trying to catch up on what they are doing. But for me, I think it's about time that we are partners with government, so that we are co-creating some of these solutions. If they're like now they have an issue of gender-based violence, increase in domestic violence, we know what that means to children. We are seeing children being exposed to violence at very young age, children being violated themselves. So instead of government start cracking their head and start, like now I was added in a group for GBV. So instead of them, it will be the answer as you're telling them, by the way, we can already have started like this. And for us, like in Africa, we have an advantage that we are a few weeks behind other continents. So we should start learning what is happening in other countries, that we can start modeling our interventions. Like for example, what is happening in America now with domestic violence. I saw the other day, I think, is it in Britain, that they have started giving shelter places for women who have domestic violence, and that's a government initiative. Can we start doing that before we start learning? Because the pandemic is taking the same course all over the world. It's taking, this week this is going to happen, and we're a few weeks behind. Can we start modeling our interventions against what other countries are already experiencing? So that's my challenge to all of us. Thank you.
Well, thank you. Thank you, everyone who's been on this call, including the audience. Like I said earlier on, this is really to call us to action at community level. About 2 weeks ago, we had a webinar, and I had a global panelists, and what we were asking ourselves, what should low, middle income countries do in terms of this? And I think if you look around on media, there's a lot of growing consensus that we do not have to copy paste. And of course, then the question becomes, so what are we going to do differently? I think the strength of countries like Kenya has been in very good community networks. So let's exploit that opportunity. As all the panelists have put it here clearly, there is space for civil society organizations. There is space to even contribute to evidence that will inform policy, and not to sit there, give feedback back to the community, be able to engage with the policy makers, so that we're not people waiting on the side and come out and say when all this is done that, oh, here we are. I think we need to be part of the action now, and that every action counts. So let's continue the engagement. I've shared on the YouTube chat an email address you can write to Children Agenda Forum. There is a mapping that we've been doing over the last 2 years. We have about 60 organizations in that platform, and we want to rapidly expand that now, and then we'll follow it up with tracking what actions you're doing and where is the gap. Hopefully, if we have some money, we want to put a live map, so that if you click at a county, it will tell you what are the data issues, what are the gaps in terms of interventions. I think this will help us really see a more updated or sort of current intervention that matches the need. Otherwise, thank you very much. Let's keep the conversation, but more importantly, roll up the sleeves and do something. Thank you. Thank you, Jennifer, for hosting us.
Thank you guys for joining
bye-bye.
Bye.
Thank you. Bye.
Bye, everyone.
Bye.